need to get to the patient to see what's wrong.
But first, fun fact. Did you know that although individual intelligence is not affected, reading, writing, and sign language skills can be?
Looking at these patients' file, it seems that the patient suffered from severe head trauma. So the patient might end up suffering from aphasia, which is the loss of ability to understand or to express speech caused by such a fall. This can also be caused due to disease, brain tumors, or progressive neurological disorders. Now we'll explore to see whether the patient has suffered from Wernicke's aphasia or Broca's aphasia. UCLA's B-Plate Dining Hall is well known for its healthy meal options. What are your thoughts on B-Plate?
B-Plate, health and kale, and feta dining, 2 swipes and bananas, and yes, dining.
A few moments later.
And lamb chops, lines, long lines, and chipotle chicken bowls at 10 o'clock. Servers, 2 servers, and chewing. Chewing, yes, is good.
What you just witnessed occurs when Broca's area, located in the left inferior prefrontal cortex, is damaged. This is the area responsible for language production. This patient typically has normal comprehension with meaningful speech. The problem is the lack of fluidity, choppiness, and overall difficulty in expressing what they want to say. Next, we'll look at Wernicke's aphasia, also known as sensory aphasia or fluent aphasia. So, can you tell me what the object is that you are holding?
Well, this and this and this and this. These things go in here like that, and this is things here. This one here. These 2 things here, and another one here. Back in this one looks like this one.
Yes, I see. Could you please elaborate on that?
Well, I can't tell you what this is, but I don't know what it is, but I don't know where it is, but I don't know what's under. I know if you can say it is, I can say it what it is, but I couldn't say what that is. That should be right in there. That's very bad in there. Anyway, this one's here and that, and that's it. This is the getting in here, and that's the getting around here, and that's it.
In contrast to Broca's aphasia, Wernicke's aphasia is damage to the Wernicke's area, located in the posterior lateral fissure of the temporal lobe, the area responsible for language comprehension. The patient maintains a normal rate and rhythm of speech, however, the speech lacks semantic value. Moreover, the patient will have difficulty understanding what is spoken.
Fun fact, did you know that non-language areas of the brain, such as the motor cortex in the right hemisphere, can assist the areas of damage and may help alleviate symptoms of people with aphasia?
Wernicke's patients seem to suffer from much greater disorders of thought than Broca's patients, who often seem able to reason much as before their stroke, but are simply unable to express themselves fluently. However, their non-fluency causes them much frustration, and they are said to be unhappier than Wernicke's patients, who are often blissfully unaware that nothing they say makes any sense at all, and whose higher level thinking processes are often as haphazard as their languages.
Fun fact, did you know that the brain plasticity, or the brain's ability to repair itself, can usually help people with aphasia recover if damage is due to a stroke or head trauma?
Although aphasia targets the communication skills of patients, it can lead to a great impediment in their everyday activities. There are a few possible treatments that can help alleviate the symptoms of aphasic patients. Such treatments include individual group sessions, speech-language pathologist who works on activities to improve specific language skills affected by the brain damage, and helps the person with aphasia develop and use strategies to improve overall communication in a variety of situations.
But wait, there's more. Time for one more fun fact. Fun fact, did you know that about 1 million people have aphasia in the US?